Hello, friends. Welcome to the Ancient Health Podcast. I'm your host, Dr. Chris Motley. And today I wanted to talk to you about the relationship between chronic sinusitis and tonsillitis, the congestion in your head, and that relationship to your digestive system, especially gastritis or acid reflux, upper stomach issues, even ulcerative colitis, and any type of inflammatory bowel syndromes. Now, in Chinese medicine, there's a definite connection between how your digestion works and what goes up in your sinuses. But I wanted to give you some review about if you have chronic tonsillitis, if you have an issue in your throat where you can always keep getting chronic sore throats every season, if you're always congested, always having to hawk up spit and snot, or if you have snot in the back of your nose above your mouth, then this podcast is for you, because we want to make sure that we can't separate what's going on in your head apart with what's going on in your digestive system. Because there are certain meridian points that travel along and around your sinus glands in Chinese medicine, and those pathways travel down through the neck, i.e. around your tonsils, and down the chest, through your lungs, and right past the stomach. Just remember, think of Chinese medicine acupuncture points as small roadways of electrical energy. They're traveling up and down your body all day, and there's particular pathways. And one of them is the stomach meridian. And this is important to you. Why? Because your digestion can determine what goes on in your head, i.e. digestive issues leading to brain fog, cloudy thinking, memory problems, even set the stage for harsher things such as dementia, Parkinson's, Alzheimer's. Now, I'm not saying it causes it, but can definitely weaken the electrical system within the head, causing the head to be weak, not allowing you to get full energetic capacity in your brain to allow the proper functioning of the mind, of the brain. So that is why it's important for us to take care of our digestion. For us to have proper mental capacity, we have to clear the throat, we have to clear the digestion, but knowing the importance of why your digestion determines the health of your head. So I've had patients, many patients that have had this symptom. They call it the ring around the mouth. Chapped lips, dried lips, burning lips, cracked lips. And one patient in particular, she's a young lady, now in her teen years, but she had had small chapped lips that turned into really red lips around her face, around her mouth. And she had breakouts, almost like staph infection, on the lower sides of her cheeks. Well, furthermore, she's already having digestive issues. And so I started to investigate, and she was coming in mostly because she was having sinus congestion, chronic sinus congestion. She had the rings around her mouth, but then she started having these dark circles under her eyes. And she started having bags around her eyes, and she started having a sinus congestion so bad, especially on the right side of her head, around the sinus points below her eye, on the side of her eye, and above it. There's 3 to 4 different types of sinus are basically in your head around the face. Frontal, maxillary sinuses, temporal sinuses, and even your ethmoidal. They're around your eye. And she was starting to get so congested just around this area. If you guys can see me on the video, just above and on the right side to where she couldn't breathe out of it, was causing such bad migraines that she was basically losing hope going to school. Her schoolwork was taking a beating. So as I investigated, I found 2 things. I found the sinus acupuncture meridian very blocked. And I found that her spleen meridian was blocked. So in the Eastern medicine world, the stomach is related to the spleen. They're paired meridians. Why? Because the stomach and the spleen are right beside each other. The spleen is attached to the side of the stomach. The spleen releases enzymes to go into your stomach to help you to break apart starches and some fats and some sugars. Now, the spleen also acts like a sponge, and it mops up and it filters out infections that are in your lymph nodes. So if you've had a lymph node issue, i.e. mono, Epstein-Barr virus, or strep, that is being filtered in your spleen all day, every day, so that you clean out your spleen and your lymph. They're called lymphatic tissue. Now, when this occurs, the spleen gets sick and it's on the side of the stomach, so it's pushing probably infections inadvertently into the stomach and into the pancreas, which are right there all beside each other. So I asked the patient, do you have sour stomach? Yes. Do you have bloating? Yes. Every time I eat, my stomach pooches out. I get indigestion. I have a sour stomach. I get aches and pains, and I get constipation and diarrhea off and on. I said, okay, let's investigate further. Found the stomach meridian, which is related to her chest muscles, because the stomach meridian runs down through your chest muscles. I found the spleen acupuncture points, all blocked. Now, when I asked her questions further, I said, well, what happened when you were younger? Let's go back. What about your digestive system? What happened that would make your spleen work hard and overworked and get tired? I said, well, did you ever have anything that would attack your lymph nodes? Anything? Did you ever have strep or Epstein-Barr? Because remember, I found the strep meridian, and that's related to the lymph nodes. And she said, yes, when I was a baby, they said, when I was very young, I had strep 5 times, to the point where she had to go to the hospital. Her throat clogged up so much they had to take her tonsils out. But from that point on, she had to have sore throat spray because her throat always got tender and sore throughout the years. In different seasons, it would flare up. She noticed that her mouth started to have the ring around it. Started getting congested in her throat, even though her tonsils were out. The area behind her nose and above her mouth had snot consistently. So I said, okay, you had this strep issue. I asked her mom, does she still have strep? Well, she's a carrier, but she's not actively showing symptoms. And I was like, well, in my opinion, I think she is. When I did different muscle testing processes, I found out that the frequencies of the strep were in her spleen. Even though it wasn't active, it had resided in the spleen, and it was infecting her stomach. I believe it was active. It was hiding. So she has this spleen infection, passing it to her pancreas, and now she's starting to have sinus congestion. How in the world can sore throat and having tonsillitis, your tonsils removed, be associated with anything with your digestion in your head? 2 things. It's been shown through research that strep can move down through the esophagus and into this diaphragm, through the diaphragm, and into your stomach and spleen. That's one way. So already, the strep is moving down into your digestive system, infecting the upper digestion. And then it gets into the lymph system because your body's trying to clean it. And the lymph then pushes it through your spleen, and then the spleen gets infected. So you have a double whammy in your stomach and spleen. They're paired up meridians. They're brothers, and they basically are sitting there right beside each other, and they're trying to help each other out. One's a yin organ, one's the yang. Hollow organ, the stomach, is the yang. Yin is the spleen. It's a solid organ. But all that to say, if one gets weak, it will try to draw strength from the other. That's how the paired meridians work. They try to pull energy from each other. So she got sick, pushed that strep into her spleen and stomach, because it's the natural process. And then it caused inflammation in the stomach, pushing the chi right back up into her sinuses at the stomach one point, pushing the energy and making it stagnant in the spleen meridian, which is around the rib cage. I want you all listening right now, those who are watching, is to basically give yourself a small hug and take your fingers on your rib cage, and maybe you won't have this tenderness, but put your fingers all along underneath your armpit, all the way down your ribs. Go all the way down the side, right underneath your armpits, and follow your ribs all the way down, and just put your fingers between your ribs. Are there tender points? Reach up below your eye, 1 inch below your eye on each side, and push that point. It may not be tender, but that's the stomach 1. That's where that energy and that chi was being blocked. So the energy that's below the eye, flowing down to keep the sinuses clear, that's the stomach meridian. And that's blocked now in this patient. So it becomes inflamed around her eyes. There's not enough electrical chi to push the snot out. So it gets stuck. Then the ribs get tired because the spleen meridian is off and the lungs are not being able to cough and push the sputum out, so the lungs get congested too. So this was blocking her stomach meridian. Now the stomach meridian, if you guys can watch on camera, goes below the eye, but it has this really weird pattern. It goes around the mouth, literally, and then it makes its way down the throat in the front and through the chest, down through the stomach, down through the legs. Literally. But around the mouth, the stomach meridian is circling. And when anybody has a chapped lip problem, red lips, I know they have stomach issues. So she now is having gastritis too. She got the sore throat. It went down through her throat and her lymph node system, infected her stomach. Now she's having bloating, and she's had the chronic issues in her gastric area. And this is pushing the chi back up into her throat, around her head, causing her to have the sinusitis. It's chronic tonsillitis. Now, she's had her removed, but the area of you individuals that had chronic tonsil issues, thinking that you got rid of your old tonsil infections, the old mono and Epstein-Barr, oh, they said I was clear. If you have the sinus congestion, if you have it blocked up, and you have tonsillitis issues or cervical lymph nodes in your neck that are always congested and knobby and swollen, you have to clean your stomach and your spleen, and that will release the valves underneath your eyes to drain those toxins down through your body. So does that make sense? We have to clean out the stomach. We have to clean it out, and the spleen, to give release to the blocked meridian system so the chi can actually flow down from the eyes and from the ribs so you can breathe better and your sinuses decongest. That's it in a nutshell. So if you have chronic gastric issues and you're starting to notice I have chronic sinus congestion and chronic throat issues, I can never get rid of this throat problem, I can never get rid of my tonsil issues, then you need to look at your stomach. I'm with you. I've had many friends and patients that have had to get their tonsils taken out. When they're young, they're so young that they can't get rid of it because it's so congested that the white blood cells are basically built up to try to fight off this infection. So they start getting tonsil stones. So they get tonsil stones, they start getting these rocks in their throat, and they can actually press them out. Now, at times, they have to clean out the tonsils and get them removed because they're so big that they're blocking the airway. Have I seen some individuals use herbs and antibiotics to help clean it out? I have. But I have seen individuals where they've done everything and it was just a point where they had to probably get them removed. But I tell them, let's use herbs and let's use good vitamins and minerals to help clean up the system, to actually help your liver clean out these infections continuously. So even if the tonsils are not there, you'll be able to live a normal life. So that's it in Chinese medicine. That's the connection. So I like to look into cleaning the spleen and pancreas and the stomach. I have a few favorites. I like Chinese Coptis, which is called Golden Thread Supreme. Now, Chinese Coptis is really good because it's Chinese medicine's antibiotic. It kills off everything. Yeast, mold, bacteria, viruses, parasites. It's really good. That's one option. My next option is an Ayurvedic herb called Malia or Neem. Neem leaf. And Neem is so good, it cleans up everything. It's probably as strong or even stronger than Coptis. But these two are very strong and powerful. You can use this, and you don't want to take it and cause your body to drain so badly that you feel like you're going to like a Herx reaction, a detox reaction. But they are really good at cleaning out the throat. They can flush and cleanse. Those are two options, my first two options. For children, I use Scutellaria, a tincture, Scutellaria, by Supreme Nutrition Products. Scutellaria is called Chinese skullcap. And I use these tinctures along with sometimes black walnut. If your child doesn't have a nut allergen, you can use black walnut. But Scutellaria will go in and kill a lot of the candida and the fungus and the bacteria in the throat. And it doesn't taste that bad. So I use Scutellaria, according to the dosages that they show on Supreme Nutrition Products website. I use my own method of dosing out, but children, I usually do half the dosages recommended to start off. But they like the taste, so Scutellaria is one option, and I like black walnut for adults and kids. Black walnut hulls are often thought that it only kills off parasites, but it'll kill off fungus, bacteria, yeast, and mold. It is so good. It's one of my favorites. So you can look at these options and find the one that resonates with you. That's my saying. Find the one that resonates with you. Ask your primary care doctor if it's something you need to look into. But if you start using these are multi-antimicrobials. They're multi-antimicrobials, which means they'll clean out the spleen and the stomach. They'll actually clean out the throat at the same time. So if you use these to clean out, I often look into Chinese formulas or glandulars that heal up the spleen. I like spleen desiccated. The Standard Process has this. There's some good glandular places or companies that have spleen glandulars that you can use to help build up the spleen. I often look at using castor oil packs around the stomach and the spleen to help draw out the poisons. I like to use cold laser therapy. I use it every day. I use a cold laser on the spleen of individuals. If you have a cold laser or red laser, or know a good practitioner with a good red light, use red light therapy on the spleen. I often look into saunas, hot saunas or infrared saunas to help purge the lymph system. Red sauna, hot sauna. I love incorporating colonics or coffee enemas. These are things. Coffee enemas or colonics regularly throughout the week, maybe 2 or 3 times a week, are great at cleansing the colon and the liver, cleaning out, as a result, the spleen and the stomach. Do not underestimate the power of a coffee enema. Please, all you guys listening out there, don't turn your head and go, that's gross. I'm telling you, look into coffee enemas or colonics using red light therapy mixed in with saunas, if you can. And I want you to think about looking into these herbs. The Coptis, the Neem, the Scutellaria, the black walnut. And when you start to flush, the spleen will start to feel regulated. I say look into acupressure. Use acupressure. There's a great book, write this down, called Acupressure Made Simple by Deborah Bleeker. And look at the stomach and spleen points and start rubbing those points and treating yourself, and watch your tonsillitis and your sinuses get better. Guaranteed. And please write me back when it happens. You can use different ways to find out what's going on in the throat. Now, you may ask, what are the things that I can do to find out if I even have the tonsillitis or sinuses? Well, I like using Microbiology DX. Microbiology DX is a good lab that uses biofilm and Marcon's testing in the nose using a swab to find out if there's biofilm up in the sinuses, around the nose, and in the facial cavities. Some biologists say that it all starts with the sinuses. So if you go to Microbiology.dx, it's about $100. You get tested, find out which bacteria or mold or yeast is in your sinuses, and then go to Supreme Nutrition Products and find out which product kills that type of bacteria. I can guarantee 95%, that those infections are probably in the lymph system already because they've been in your head for so long. And they're draining down into your lymph nodes through to your spleen. So you find out what's in your head. You can guarantee it's probably in your stomach. You start using the herbs, you start using these other therapies, but please look into the coffee enemas. Clean the colon and the liver out. That will be one of your biggest things you can do. If I could be adamant on this podcast, looking to do it 2 or 3 times a week. Even young people can do colonics, but ask your primary care doctor if it's the right thing for you. I've seen people get so clean by using coffee enemas and using 1 or 2 of these herbs and cleaning that spleen and using some spleen glandulars. I think that whenever I've done this, I have seen that the stomach cleans out, and then I go after the parasites. Clean out this, and that black walnut will kill it off, but go into higher liver and parasitic investigation when you get done with the stomach and the spleen, okay? Look at parasites.org afterwards and start looking for the parasites and start cleaning them out, like with black walnut or Artemisia. When you do this, your sinuses are going to drain. If you have to go further, go find an acupuncturist or Chinese medicine practitioner and get them to do acupuncture on your spleen and stomach meridians. Ask them to find out what's blocked, start working on them, using acupressure as well, even getting chiropractic care around the T5 and T6. That's why it's always sore, your mid-back, between your shoulder blades, because that's the spleen and the stomach. If you have sinuses and you have pain between your shoulder blades, you basically are going to have what? You're going to have a connection where the stomach and spleen are injured from your sinus issues, and that area of your spine is where those nerves enter the spine from your stomach and spleen. See, it's all connected. Don't think one's separate from the other. So let's clean up the digestive tract with those things I just recommended. If you know other herbs, guys, you can use those herbs, but just remember, these are the organs that you have to address. These are the things you need to do to get the ball rolling. I'm the individual, I think, that can get the ball rolling, and we're going to have more insight. I have more insight in my membership where I try to put a little bit more investigation into deeper herbal investigations and reports and recommendations, but these will do the job. There are some deep cases that I know that are really hard, and if you like to hear stories and like to hear like some of the accomplishments that the herbs have done, check into my membership. Not trying to plug it too much, just letting you know that it can be there to help. So if you guys like this information or have extra questions, please send me comments in the comment section. Please send me ideas that you would like to hear on the podcast. Like it, give me a thumbs up. If you have thoughts and ideas, I am always open to hearing more research and your thoughts and ideas. Please don't think I know all of these things and I set in stone. I love to hear new things. I don't want you to think that it's my way or no way. I love Eastern and Western medicine, how they intertwine. Please send me the information. If you like this channel, please subscribe and let us know what you think. All right? So let's clean up the digestion, help the sinuses, clear out the throat and the tonsils. And until next time, let's keep on cleaning the body, detoxing, and I hope to see you soon. See y'all.